Welcome to Learning Unit number 5. In this learning unit, we're going to focus on hospitals and other specific other healthcare organizations, about the need for them to build and maintain strong linkages with community stakeholders. And that's being done to ensure that the needs of vulnerable populations are supported. As we know, the social determinants of health are population focused. And then we looked at health related social needs. And health related social needs are often identified as the root causes of disparities in health outcomes. So we're really going to focus more on those healthcare disparities. What are the root causes of these disparities? That includes identifying barriers to health priorities, and really aligning efforts to address them. So we want to, as nurse leaders, help to continue to improve access to care and access to quality care, especially for those who have unmet needs. So as part of this, we're going to look at the community benefit. This is an obligation of tax-exempt, not-for-profit hospitals. As part of the community benefit obligation, a community health needs assessment needs to be done every 3 years. And this is really what forces nonprofit hospitals to look outside their walls and engage new partners, instead of just focusing on charity care or paying for the bills of those that are admitted. So we're really going to look further into community engagement as we go forward. So you're going to do a lot of reading this week, but I think it's important readings. And then you're also going to spend some time completing the spent scenario game. So let's look more closely at this. So let's start with the spent scenario. I don't want you spending a lot of time on this. If you get caught up, please don't keep going back and forth. But this gives us a nice perspective, especially because we are well off and have the money that typically we need to get through the month. So this was developed by urban ministries, especially who they have expertise in caring for and serving people who struggle with poverty and homelessness. So it's an interactive game that puts you in the position of balancing on the edge of homelessness. So again, take note that this is a game. In order, the object of this is to give you maybe a little different perspective of what it truly means to have no money left in your pocket at the end of the month, and how are you going to pay bills, etc. So engage in this game and take notes as you go through. And these are the type of notes that you're going to take. Did you make it through the month? What was the most difficult choice or sacrifice you had to make? And did you cut any ethical corners as you did that? Why? Did you reach out to friends for help? Take notes, because this is going to be your discussion board post. You don't have to reply to anyone this week. This is just, you're going to share your experience. This is not going to be APA formatted. It is a share your experience with the spent scenario. So that's your discussion board. You're also, as you see here, going to do another journal on loss, reflecting on 2 coping mechanisms that you found helpful in dealing with this loss or others. But I want to get back to the readings then for Unit 5. So I'm going to enter into the folder, and we had Chapter 6 that we're reading in our ebook, and that is on community engagement and partnership. So those readings aren't that lengthy, but I think very important about partnering with communities. And so that's one of your readings. These are now the three readings that I would really like you to focus on. First of all, should nonprofit hospitals' community benefit be more responsive to health disparities? So really dive into this article to learn more about what is the community benefit and how is that going to help eliminate or address health disparities. And the second one is an article that was shared by Sarah earlier in our readings, and it's from the Joint Commission. And this is one that I really want you to take a very close look at. This is a new requirement that the Joint Commission is putting into place for January 1st, 2023. Who has to, what type of healthcare organizations are required to do this. But this is a requirement to reduce healthcare disparities, and it has 6 new elements of performance. So I'd like you to spend a little time with this, and this is going to help you on your vulnerable population number 4 assignment. So as you look through, this gives you a nice introduction. Please read the introduction. And then you're going to look at the 6 EPs. And I just skipped over the first. So let me make that a little, it's not going to make it a little bolder, a little bigger. That each organization designates an individual to lead these activities to reduce healthcare disparities. And the second one is that the organization assesses health-related social needs and then provides information about community resources and support services. Now, this is an important area as far as examples of how to do that are what you're going to assess, or what that individual that oversees, that leads this, is going to assess is perhaps it may include the following: access to transportation, difficulty paying for prescriptions or medical bills, education literacy, food insecurity, and housing insecurity. So remember, these are health-related social needs, and this is what the Joint Commission is recommending, that these social-related or health-related social needs include an assessment of these specific needs. So I will let you read through the rest, but where I want to take this next is the last reading that you have. And it is a short 2-pager. It was put together by the American Hospital Association. And let's just take a peek at it, because this is, again, what's recommended as far as addressing the social determinants of health is, number 1, starting by gathering the information. So this is going to sound familiar, just as the Joint Commission is saying that we need to assess the health-related social needs of the patients that we serve. And they had those, the housing insecurity, the food insecurity, access to transportation, and a few others. This document, which was put together by the Centers for Medicare and Medicaid, so CMS, also speaks to the determinants of health. But I want to show you one other tool that I think is very, very helpful. And you can use the CMS's 10 questions screening tool. So it is very similar to um, that recommendation by the Joint Commission. Let's skip down to this first area. So just like the Joint Commission recommended assessing housing instability, this one gives you some questions that you can ask patients or that patients can be screened for, maybe in a survey format, about housing instability. I really like these questions. I think you're going to find these very beneficial to give you a good idea of the type of assessment. What are we asking about? Inadequate heat. That's a biggie. So housing instability includes, in Erie, Pennsylvania at least, inadequate heat. But it's talking about, you'll see they're asking two questions. Food insecurity. This is a way to screen our patients. Have you worried that your food would run out, etc.? So that's another one that the Joint Commission. The Joint Commission also recommends focusing on the assessment of transportation needs. Now, where it differs is it has utility needs, and then it spends a lot of time as far as asking about some interpersonal safety. That isn't recommended. That's not to say that a healthcare organization couldn't assess that. But the Joint Commission then spoke to education, assessing for education and literacy, and difficulty in paying for medications and medical care. So, but these are great screening tools to use. So I really wanted to give you that opportunity to look. And again, you can click on this link and it will take you to that document. So we're moving along, and I just want to come back. There's an optional reading about public policy if you're interested in that. But otherwise, you're going to then be able to complete the last vulnerable population assignment. So it's a maximum of 3 pages following APA. And based on all the work that you've done, the mind map, the identification, the other work that you have done on your vulnerable population, make sure you can now clearly define your population. Have you gone a little bit more specific than general? Clearly define your vulnerable population and discuss the health-related social needs faced by your population. Choose one example in your paper of a health-related concern that your group is at risk for experiencing, as well as the implications for nursing. Provide rationale for why addressing this group's vulnerabilities is important to society as a whole. And then I've changed one thing that you might see differently in your syllabus. I updated the syllabus, but instead of speaking to current public policies that are relevant, I really, it's still showing here, yes, number 5. You can do that to describe 1 or 2 current public policies. But I'm hoping that you can briefly describe the Joint Commission's requirement, the new requirement, the 6 new elements of performance for addressing healthcare disparities as a quality and safety priority. You don't have to search for 1 or 2 current policies that are relevant. You can go that way. But what I'd like you to do, and it will have an updated terminology in number 5 when I finish this video, but I want you to look at the Joint Commission requirements and show how this new requirement is relevant to the concern that you have chosen to talk about your vulnerable group. So the wording will be different when you look. I thought I had updated, but evidently it didn't update on this page. So you can either briefly describe one or two current policies or use the new wording to integrate Joint Commission. Thank you.